to be followed by the Honorable Minister of Health, then the representative of DG and CDC, National Coordinator, and as appropriate, we would invite other ministers for update. At this point in time, I have the privilege and honor to invite the Chairman of PTF and the Secretary to the Government of the Federation to the podium. Good evening, sir.
Really run with this program because we are running far behind schedule, and our apologies, but we have a lot of issues that we wanted to deal with. However, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Thursday, 20th August 2020. This morning, Nigerians woke up to the stark reality that our confirmed cases of COVID-19 have crossed the 50,000 mark, standing at 50,488, and a death toll of 985, bringing us close to the unenviable record of 1,000 fatalities. These records are not landmarks to be celebrated, especially as every single death further underscores the grief and pains of families and friends, scattered lives that could have contributed to national development and are bridging God's purpose for the lost souls. This is aptly demonstrated by the fact that 14 of these paid the supreme sacrifice as they were doctors who toiled daily to save lives. We have continually prayed for the repose of all that lost their souls and worked to ensure that their dead are not in vain. The most edifying tribute and respect we can pay to these people is to do the basic minimum in avoiding such fatalities in the future. The Presidential Task Force will therefore not fail to continue on the path of moral persuasion, because the superiority of personal conviction on grounds of morality remains a more effective and dignified approach in appealing to our individual and collective conscience on the need to wear our mask properly, maintain social distancing, avoid crowded places, and continue to maintain personal hygiene. It is hoped that when implementation of the new policy on ethics and integrity that was approved by the Federal Executive Council yesterday commences, Nigerians would have the necessary incentive and impetus to always do the appropriate thing in all circumstances. Because if we have relied on our all-age value systems of integrity, adhering to guidelines would be second nature to us as citizens. The coronavirus continues to display unpredictability, especially in its characteristics that show its relentless nature on populations that disregard common and simple protective measures. Such behavior has been amplified in the surge in some states of the United States of America. Similarly, this unpredictability is reflected in the last 24 hours when Plateau State witnessed the highest daily number of confirmed cases. In the last 2 days, the World Health Organization, WHO, had issued warnings on vaccine nationalism and that young people are aiding the spread of the virus. The latter is more germane for us as Nigerians with over 80% youthful population and should give us more cause to be on our guard. It would border on extreme selfishness for our youth to believe that since they are asymptomatic carriers, they can carry on with life as they please. More so, that being asymptomatic does not guarantee immunity forever. The Presidential Task Force is, however, encouraged by the fact that majority of our youth are in the vanguard of this fight and still call on the few non-conforming ones to join in the fight. This call becomes more imperative when we realize from an initial 10 hotspot local government areas in the country, we moved to 16 and now have 20 of such, indicating spread to other areas. More worrisome is the fact that the initial hotspot areas were easily accessible to medical support, albeit the new ones are areas more removed from such medical support. Furthermore, the recent case of infection among students sitting for the senior secondary school examination calls for more vigilance by the education sector and all of us. So far, our national response has shown that Nigeria is following the science through effective case management, but need to improve on our testing. Our testing infrastructure has been increased to undertake up to 15,000 tests per day, but we are currently testing between 3,000 to 6,000 daily, due mainly to people still not subjecting themselves for testing. I therefore want to seize this opportunity to enjoin Nigerians to get tested. The Presidential Task Force continues to analyze and rely on data to forestall any sign of upsurge and adapting best global practices to sustain our successes. That Nigeria, along with South Africa, Kenya, Ghana, and Algeria, contributed to the recorded lowest weekly coronavirus confirmed cases is a testament of our successes. The challenge, therefore, remains for us to improve on the path of driving the pandemic out of Nigeria so that we can go back to our normal lives as soon as possible. We are happy to inform you that our partners are still providing us with support to fight the pandemic. And the recent novelty by the German Federal Foreign Office, who donated 54,000 euro worth of PPEs to be locally produced to the Nigeria Immigration Service and the Ministry of Aviation, looks quite exciting. We want to thank the people and the government of the Federal Republic of Germany and also encourage our local manufacturers to rise up to the challenge and produce more PPEs of international standard. As we further open up the aviation sector with the planned operation of international flights anytime from the 29th August 2020, beginning with the Nnamdi Azikiwe Airport here in Abuja and the Murtala Muhammad Airport in Lagos, the Presidential Task Force seeks the cooperation of all stakeholders to work at arriving mechanisms that will be mutually beneficial to all stakeholders. The Honorable Minister of Aviation or his representative will further provide details in the course of this briefing. Let's keep arming the indefatigable spirit of Nigerians, and that is the spirit to win this war and drive the virus out of our land, or systematically contain it as much as we can do until vaccine or any form of cure shows up. I now have the honor to call on the Honorable Minister of Health Thereafter, the representative of the DG of the Nigerian Center for Disease Control and the national coordinator to provide us with the necessary details. I thank you so much for your attention and have a very good evening.
And Secretary to the Government of the Federation, Honorable Ministers, National Coordinator, Permanent Secretaries and Directors, and ladies and gentlemen of the press. Nigeria has, as at today, crossed the 50,000 landmark and recorded 50,488 COVID-19 cases. This is out of 366,244 samples tested so far, of which 37 persons among those recorded as positive have been successfully treated and discharged. We have sadly had 985 fatalities, which is also a reminder to all of us that COVID-19 has not abated. The male to female ratio remains at 2:1, with more infections in the age group below 50 years, but more fatalities in the higher age bracket, and also among the vulnerable and those with fragile health conditions. The changing dynamics of the virus and the disease make it necessary for us to continue to review our response strategies, and we ensure we train and update our health workers on the latest and most effective approaches to treatment of COVID-19 and tailor our procurement also in the light of knowledge gained. We have said before that we pay more emphasis and attention to oxygen concentrators now than to ventilators. The Department of Hospital Services of the Federal Ministry of Health leads the effort for training and retraining, and we are also training intensive care experts in case we need them for intensive care stations, and also general training to improve the pool of experts and focal persons in various specialties, particularly with the strategy of training trainers, and in infection prevention and control at all service levels and in all health facilities. The information session on COVID-19, which is conducted weekly by the World Health Organization, was held this morning, and I had the opportunity of sharing Nigeria's experience as one of 2 countries who were invited to make presentations on our response strategies. A clear message from this briefing is that COVID-19 is a threat to mankind, and there is need for all countries to work together for solutions that will allow equitable access to information and also on therapeutics and vaccines. In the words of the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, by working together, we are protecting each other, and in a global pandemic, none of us is safe until all of us are safe. Nigeria is also working with the World Health Organization to finalize enrollment and participation with the ACT, Access to COVID-19 Tools Accelerator, a global mechanism tracking and sponsoring research organizations working on COVID-19 vaccine development, and also have interest in the COVAX facility, which is a Gavi-supported global initiative to procure and assure equitable access to vaccines as soon as they are available, especially for lower and lower middle income countries. This will prioritize Nigeria for allocation of a part of 2 billion vaccine doses that will be secured in a special plan to protect the interests of poorer countries. I shall end by reminding all of us to take responsibility together, not only for today, but for the days ahead, when the imperative to open our economy and also to allow people to make normal livelihoods will demand great sacrifice and discipline from all of us. The new normal, to compensate the effect of allowing free travel and commerce, will be demanding for all of us, but we all, government and citizens, must collaborate to halt the spread of this disease for each other's sake. Global experience so far has proved that by following advisories and adhering to prescribed measures, including appropriate wearing of masks, physical distancing, respiratory hygiene, we can control the spread of this disease and mitigate its effects. The health sector on its part is continuing to strengthen itself as we develop new coping measures to counter the challenges that we can see coming ahead, from developing ambulance transport systems for patient transportation to improving treatment and case-finding options. Thank you all for your attention.
Journalists, ladies and gentlemen of the press, good evening. Actually, today I really want to discuss something that I have been promising that we have been working on. I talked about developing a platform to enable us receive our reports in good time using the technology. So today I'm pleased to tell you that we have commenced that in the FCT. We piloted it in FCT. Now, if you have your test done and you're negative, you will get an SMS to tell you your result if it is negative. So in Nigeria, as in other several countries, even in the western parts, it's a major issue in terms of getting your results. It's not been easy globally, and generally it takes over within 24 to 48 hours in concluding the testing samples. And of course, we have expanded our laboratories, and so that's making the turnaround time shorter because the laboratories are closer to the people. And we have equally been working hard to ensure that these results are communicated directly to the individuals. So in collaboration with the FCT, we piloted this technology, and it's been successful, so we're going to roll out in other states very soon. But for now, it's only negative results that we're sending out. We communicate only negative results through the platform. This is actually to ensure that the positive results are well taken care of, because we will need psychosocial support. It's not good for you to get a report that you're positive on SMS. That's not polite at all. So that, for now, will be communicated by the health workers. But all negative results will be gotten that way. Now, how does it work? Once the test is done, it's loaded into our digital platform called SUMMERS, the Surveillance Outbreak Response Management Analysis System. Is a platform that we're using for our management of outbreak, collecting our surveillance data for all diseases, not only COVID, but for all reportable diseases in Nigeria. So what happens is, once there's a negative report from the lab and it's keyed into the SOMAS platform, it will automatically give you an alert, because that's why we said you need to have a proper information. That's your phone number, because that's what we use. So it gives an alert directly, and this prompt, as you get the SMS. Now, when you get the SMS, it tells you your result is negative. But if you need to go further, you might want to print, or you might want to just check it. So it gives you a code which prompts you. You click on the link, and it takes you to a microsite. In the microsite, you key in your code and also enter your phone number. This is just for double verification. And then, once you key it in, you key in your name, your first name and last name, and your date of birth. Very important. We want to make sure that you are the owner of the result. So your date of birth also must be there. So that's why it's very, very critical that we put the right information so that we can get a result. I mentioned here that sometimes some people do not give the right information, and so you might not be able to get your result. But with this platform, you'll be able to get your results real time once the result is out. So we really want you to put in the right information. Now, for you to check the authenticity of this result, there's a QR code which contains the URL that directs the verifier. It's like you have a barcode. So if you take this to, maybe you need it in a clinic or you need it in a workplace, and they want to verify if it is genuine. Once you scan the barcode, it takes you back to the microsite where you get the full information. But of course, if it is fake, it will not take you back to the microsite. So that's how it works. Now, this result is viable for only 2 weeks. That's 14 days from the day of sample collection. Please, let's note it. Not the day you receive the result, but from the day of sample collection, 14 days. So we have actually worked very painstakingly to make sure this is done. Like I mentioned, the FCT, we've opened up the platform yesterday night. So those that test, once the result is out today, they'll get their negative result. But I really want to thank, because all this IT is in-house. We did not bring consultants from outside. It's our youth, the young ones, that designed it, developed it. So everything is locally made. So that's why we need to encourage our young ones to be very proactive, to challenge themselves and bring out new innovations so that we can use it, because this response is for everybody. So I really want to thank our team, our SOMAS team, and the FCT for allowing us to use the state at the ministry as a pilot. And I want us, and like I said, we're going to roll out in the states. But it's not automatic. We will discuss with the states. We will make sure that they agree with us before we can roll out in those states, because it's state-specific. The other area criteria that we use for the rollout in the state is their data must be up to date on the platform, because that's the only way you can send out information. Thank you.
The Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. So today I'll be talking briefly on medical research as it relates to COVID-19. As we know, the role of research cannot be overemphasized in the present response to COVID-19 pandemic. This is particularly important because the pandemic is new and we are all trying to learn from it. Within the PTF, we have a research pillar, and this research pillar works closely with the National COVID-19 Research Consortium. The consortium is a conglomerate of research entities from the government, NCDC, the academia, TED Fund, CBN, and the private sector. The consortium has developed a national COVID-19 research agenda, which was adapted from the WHO research roadmap and spans 10 thematic areas. Government agencies, states, and sectors are encouraged to align with this agenda in responding to the pandemic. The Nigeria Center for Disease Control, the National Institute for Pharmaceutical Research and Development, NIPRID, the National Agency for Food and Drug Administration and Control, NAFDAC, the Nigerian Institute for Medical Research, NIMA, and other tertiary institutions have been actively involved in pursuing research in accordance with their mandates of establishment as soon as the COVID pandemic was declared by the WHO. A registry of COVID-19 researchers has already been developed by the Federal Ministry of Health and the research pillar of the PTF. So far, 173 COVID-19 researchers have been collated, and 13 of these, which comes to 7.5% of all researchers, has been completed. Relevant findings from the completed research will be sent to the PTF to help guide response. The registry will also soon be on the consortium website. As you're aware, Nigeria has registered for the WHO Solidarity Trials, which is a multi-country trial where the standard of care in the country is compared against some investigational drugs such as remdesivir, interferon beta, and a monoclonal antibody. This is in a bid to get the best drugs to treat COVID-19. So far, 22 sites from 13 states have been registered for the trial, and the necessary regulatory approvals from NAFDAC and the National Health Research Ethics Committee has been secured. The trials will soon commence. Currently, in terms of financing of research is being done at respective institutional and agency levels. We are grateful to the CBN, TED Fund, and other parts of the private sector for offering grants to researchers, while the PTF has also got a small fund for the purpose of writing grant applications, etc. We are also grateful to the Aliko Dangote Foundation for recently funding a CPAP, BiPAP study on the role of respiratory ventilators in respiratory failure due to COVID-19, which is currently being led by NIMA. We look forward to having more support for COVID-19 research in the country. Thank you.
Before we take questions,
Honorable Ministers, ladies and gentlemen of the press. Since the announcement of by the PTF through the Honorable Minister of Aviation, the resumption of flights, international flights, is scheduled from 29th August. And I use the word again, from 29th August. That's in about 9 days from today. We've ramped up preparations. We've been preparing, and we're almost there. A few logistics to be resolved within the next few days. This resumption, we're going to start partially with Lagos and Abuja airports, and we're going to restrict the number of passengers coming initially to about 1,280, and both to Lagos and to Port Harcourt Airport, while other logistics are being put in place before we ramp the number of passengers that will be allowed to come in. So we are working on the logistics and the process and how to determine the flights, which flights will be allowed to come. That should be done by tomorrow. Hopefully by Monday we'll get everything in place. I just want to, there are certain countries that have placed ban on Nigerians and residents of Nigeria going to their country. So, in this process, we're doing determining who and who will be allowed to fly to Nigeria. The principle of reciprocity will be applied. The conditions you give Nigerians to travel to your country will apply the same thing. If you ban us from coming to your country, the same will apply the other way. It's just to get a level playing field on the issue of the reciprocity. For this process, we had a meeting with the foreign airlines yesterday. We had a Zoom meeting. We had a very good discussions. We gave them our requirements and a resumption of flights for those who will ultimately be allowed to resume flight operations into Nigeria. And I'm glad so far today we've gotten positive response from quite a few number of the international airlines in meeting our requirements. So we almost finished discussing with the health authorities on the protocols for people coming in on the checks for the COVID-19 and people going out. Hopefully by tomorrow, close of tomorrow, we'll have everything ready and the information will be officially given to all the airlines and aeronautical authorities all over the world on the requirements for people to come in into Nigeria. Thank you very much.
We're now ready for the questions, are we? Please, let's take number one.
Very much, and for the questions directed at the health sector, the health sector has worked on and has already presented the health sector, the National Health Sector Action Plan, National Health Sector COVID-19 Response Action Plan, which has been developed, and it has been presented to the National Council on Health. It has also been presented to the PTF, and has been presented to some other bodies, and I think to the Senate Committee on Health also. So there is a preparation that the health sector has made, and it is over a 3-year period. Now, it is flexible because the cause of this infection is not so well known, and it is possible to change with more knowledge as we go along. So there's a flexibility built in to improve and adjust the response plan, but that response plan is there. If you like a copy of it, you can see us at the Ministry of Health. So the National Health Sector Response, COVID-19 Response Action Plan. Yes, we have had a National Council on Health. That was the question you asked. That was barely 2 weeks ago, where majority of the commissioners were present and the issues were discussed, including this response action plan and the various experiences in responding to the specific challenges in their own state on COVID-19, which is not the same for every state. There was a question about, I think, neurological symptoms, if I'm not mistaken. I think it was directed as the national coordinator, but he will say something about it, but I also have heard about that, and we know that those who suffered particularly, you know that 80% of COVID infections are believed to have little or no symptoms. 20% suffer symptoms and 5% are critical. Many of those who suffered severe symptoms have reported various leftover feelings that they have, which have all been classified as post-COVID syndrome. The post-COVID syndrome, it includes neurological issues, ringing in the ears and feeling unwell and complaining of not being able to breathe well. I called already the Commissioner of Health in Lagos State and the manager in Kano and Luth to start collecting data on that, and they're doing it already. in those 4 centers where we have large incidents of this problem. We have huge volumes. So we're already studying it here in Nigeria. Very few cases of post-COVID syndrome have been recorded by those or in those who had mild symptoms. Very few. Most of them are those who had severe symptoms. Now, meals are isolation centers. Here, they're standard meals, but those who are on special diet, like diabetics, obviously have a special diet given to them. The food is balanced, it's nutritious, and it's going to help recovery. Now, good nutrition, balanced nutrition is a good thing for all conditions. Even for healthy people, you're supposed to have a balanced nutrition that's rich in vegetable and fruits, and supposed to be low in fat, particularly saturated fat, for your health. So those who have been diagnosed with high cholesterol know that they must reduce their saturated fat and their animal fat intake. And the diet given at the isolation centers is tailored to be able to fit the recovery. Is a lot of fruits and roughage that's included. So I think that is all for the health sector. The tunnels, yes, the tunnels are contraptions that are installed in various areas, supposed to spray you with a mist, a disinfectant mist, as you pass through. I have not read anything about how effective it is. Those who manufacture them obviously tell you the advantages. I have passed through them sometimes too and received a mist. It's supposed to disinfect everybody who passes through. But we'll wait for studies that show that it has a particular advantage over any other measure that is used. But generally, any kind of measure to do environmental sanitation, disinfection, as you see in streets, which are done by environment, will help to reduce your risk if it kills germs or reduces germs that we are worrying about. So depending on what is being sprayed in the mist tunnels, definitely it should theoretically be able to take care of any viruses that may be resting on your dress or your clothes as you walk by, for your own sake and also for the environment. Thank you.
Initiated with so many questions now. So I'll answer the last and the first question in terms of the antibody. Yes, well, the antibody testing, yes, Nigeria was selected with some other countries to test for antibody because we want to, evaluate the kit and make sure that whatever test we are carrying out is the same as any other country within the African region, because we have all the reagents that we're using. Now, the rapid test kit, antibody rapid test kit, we have not, it's still work in progress. I think I mentioned it here, that it's still work in progress. The Medical Lab Scientists Council of Nigeria, they're working with a lab to make sure that whatever we're going to bring out is very sensitive, is accurate, and specific. And that is very important for us. So, yes, we have to work with other African countries to test and see if what you're using is working, is okay, is good for us. And for the antibody, they'll test even both negatives and positives to see whether there are some people that you test negative maybe at a particular time. You might have been positive because they are symptomatic. We don't know. So maybe later they test and the virus is no longer viable and they test. So those are the kind of tests we want to carry out. We want to know the prevalence. We want to know the burden, the true burden in country. So that's one exercise that is going on. Then, okay, the results, with the positive results. Yes, I said it will be very insensitive if I send a positive result of COVID as SMS to anyone. Because before you can tell someone is positive, you need to cancel the person. And it's only the health worker that will do that. Now, in terms of, because we are going to roll out the negative result, the burden on the state is going to be reduced. Because don't forget, when you have about 1,000 tests done in a state, and maybe 90% of them are negative, or 99% are negative, you're battling with the negative and both positive. Now, if you have the negative that is going on, is automated, now you need to deal with only the small positive. So that reduces the time for the health workers. So they're able to attend more to the positive cases. But now what we are doing in NCDC is working with the state. We're supporting them to be able to do that real time, in good time, in the next maybe 24 hours once the result comes out. That's one area that we're really working with the states, and we hope that we'll be able to achieve that in the next few days, weeks, depending on how the state is relating. And then, okay, I talked about the complaint about getting tests. Now we have some sample collection center in FCT that you can work in. We have, even in the FCT director's office in Area 3, there's a sample collection site there. We have at this day dome, you can walk in there. We have in Maitama, we have in Yanya. We're trying as much as possible to spread it. So those areas we can get tested when we walk in there. So I think we should be able to get our samples tested. Now for Plateau State, the increase. Now one thing Plateau has done is they have increased their sample collection greatly. The sample collection from Plateau State is very high. It's very light because I think the governor was so, determined, and so he encouraged and made sure he provided all the necessary materials and whatever they needed to use, and they collected a lot of samples. That's why we said when we collect samples, that's when we know the true burden of the situation in the state or in the country. So they have been collecting a lot of samples, and so they're seeing the true burden in the state. And they've discharged, because they've managed a lot of cases, and they've discharged a lot. Like in the last 24 hours, I think they discharged about 240-something cases in the last 24 hours. So they are really doing a lot in Plateau State now. Now, okay, you talked about the reagent. Yes, we have issues. Sometimes they run out of reagent. That's also one area that we're working with the lab, that they need to look at their stock level and not wait until they have exhausted before they request for. But I can assure you that anytime from now, I'm sure they would have gotten a reagent. But they still send their samples to the National Reference Laboratory, and their tests, they get their tests, the samples tested. Now, for Kogi State, we have a national response team in Kogi State. Of course, we're working with them. It's a gradual process. I think we need to understand the human nature. When you say no at the first instance, and when you start to say yes, it's a gradual process, and that's what we're doing with them. We're working with them gradually to make sure that they understand the reason why we need to collect samples. They've started collecting samples, but I think is one of we're still working with them. Now, in terms of the number of deaths in Kogi State, I'll get back to you on that. I'm not too sure I got that story yet, but I'll get back once I get that information and get back to you on it. I think I've been able to answer. Thank you.
Because of time, are we holding on to passports? So we're still working on the protocol, but our aim is that everybody landing in the country will go home with their passports unless they do not comply with the protocols that we will set up, in which case we'll need to find a way of enforcing this. So how much is the test? We are still working on the platforms, the payment platforms, and as soon as that's available, it will probably be a competitive process, and hopefully that will drive down the cost for passengers. Neurological disease, the Honorable Minister of Health has already spoken on this. It's worth saying that if you take out the common symptoms of things like dizziness, which happens in most illnesses, 17-18% of them, generally speaking, neurological complications are rare with COVID. The reason why we're seeing it is because of the scale of the pandemic and the fact that you have a large number of people, which means that even if you have a relatively small proportion developing neurological symptoms, that number will still be significant. But generally speaking, the main things that you will be concerned about are things like stroke, bleeding, and loss of consciousness. State commissioners of health yet to receive their money from the federal government. Most states have received their 100 million naira REDC grants. We're working with the Federal Ministry of Finance. I spoke to them a few days ago. And in fact, even yesterday, I spoke to the chair of the state commissioners of health from Cross River State. They know exactly where we are. They should be receiving their 1 billion fairly soon, eminently, through the Ministry of Finance. The remaining 1 billion is not coming immediately. This is part of the World Bank credit facility, which has been approved by the board, but it has to go through the necessary protocols before they get their money. Thank you.
Aviation Organization, the global body on regulating the industry, does not recommend quarantine crew. I mean, if an aircraft comes to your country, you put the crew in 2 weeks quarantine. That means the flight cannot operate. What we have in place, the crew go to the hotel, they stay in their hotel rooms, and they isolate from mixing. And whenever they're ready, they go to the airport. There's special transportation to and from the airport. They go, jump into the plane, operate, and go. And most of the crew that will stay in Nigeria probably just 1 day. So it's not a big problem. And some airlines and some countries will demand the crew to have a COVID test, a COVID negative test before they go. And they're also required to provide their health information, the necessary public health forms they'll fill and state even they're sick or have symptoms or this. So that takes good care of that. On the issue of a list of countries, we are working on the comprehensive list, but the main one that came out when EU opened their borders effective 1st July, Nigeria was one among a list of 50 countries, 54 countries that were not allowed to enter EU. But my understanding, as the situation change, they're going to look at the list and change it. But so far, we don't have any contrary information to that. First, Nigeria is banned from going. A list of people not allowed entry into EU. But we're also looking at other countries, and as we open our airspace, we're going to apply the issue of reciprocity to those countries. Thank you.
I think the question was about the detection of a new mutation in Malaysia, the D164G mutation. What I can say that is, yes, on 16th of August, the Minister of Health in Malaysia reported that. Apparently, it's a strain that is more infectious than the original strain that originated from Wuhan or the strain that has been circulating in Malaysia. But it's not the first time that that particular mutation is detected. So that I want to make that point. And there are some studies that suggest that it's the more prevalent strain or mutation in EU, in Europe, and in the US. But what we need to understand, and we've been saying that since the beginning, this is a new disease. We are still learning how it unfolds. For example, there's no indication that that particular strain creates a more severe disease. So right now, what's happening in Malaysia, it has been detected, I think it's 3 cases, detected in a cluster of 45 cases in one area called Sivangkang, I think. And then there was another 4 cases detected from a returnee from Philippines. But I want to emphasize the circumstances which are relevant to what we are discussing today.
That cluster of 45 cases arose as a result of one returnee from one country who breached the quarantine rule. He was a restaurant owner, so he came back from his holiday, he breached the rule, and a cluster was created around that. So it's very important that even as returnee or international traveler coming in country, we make sure that beyond the testing, they are properly tracked. So it's very relevant. So the research is still going on what progression it can take, but as to whether or not it will affect the efficacy, effectiveness of vaccine trials or the result of the studies, nobody knows. It depends on the prevalence of that particular mutation in the global population. So if it's not a big proportion, so then it's unlikely to affect the effectiveness of a vaccine. The same could be said for treatment. As you know, and as the national coordinator mentioned, Nigeria has joined the Solidarity Trial, and which is that platform, the mechanism through which countries are encouraged to study what treatment regimen could be effective. I believe it will be the same way that if that cluster could expand, there may be some researchers interested to know how they are responding to different treatment regimen. But as to now, we are not yet at the stage to say we have an effective treatment, and that strain may jeopardize the progress. Thank you.
Well, you've asked, that's a $1 million question. What have been my peculiar challenges? As a matter of fact, let me tell you the truth about it. In coordinating this national response as the head of the Presidential Task Force with these abled ladies and gentlemen, I can assure you that our biggest challenge has been the attitude of Nigerians. That is our biggest challenge. Everything to fight COVID-19 has been placed at our disposal. We arrested the 2020 budget and got it revised, all in an attempt to deal with the financial needs for fighting COVID-19. The entire world came to a standstill, and we received a great measure of support from the UN One Basket Fund, from the European Union, from West African Health Organization, from the World Health Organization, from friendly countries like China. I just reported to you that even the Federal Republic of Germany gave their modest support to ensure that our industries begin to prepare and even manufacture PPEs locally. So every amount of support, and that's the good thing about President Muhammadu Buhari that probably a lot of people don't seem to understand. If he charges you with a responsibility, he enables you. We are not in short of any resources to fight COVID-19. We've coordinated a response nationally that pulled in everybody that mattered in this country. The corporate world, through the COVID, have assembled a huge war chest of resources. They are all over the place. Private individuals giving of their resources to ensure that we re-engineer and re-equip our health infrastructure. In terms of even testing, we have ramped up our testing capacity from 2 when we started to 64 today. Within the period of 3 to 4 months, we've ramped up our testing capacity. As a matter of fact, right now, the testing capacity in terms of volume, we can test 15,000 samples a day. But how many are we testing on a daily basis? So our major challenge as a presidential task force has been the attitude. Our response, particularly, we would have flattened the curve. We would have dampened this ravaging virus by now if we had just complied with the simple instructions And that brings me to a major thing, which was aptly demonstrated yesterday when I presented a memo on behalf of the President for the introduction of the national policy on ethics and integrity. Most of us Nigerians think that as Nigerians we only have rights. But coming with your rights, there are corresponding responsibilities that you are expected to exhibit as a citizen of the country. If our sense of risk perception had been slightly different, probably the rate of infection in Nigeria wouldn't have been the figure we are counting today. Unceremoniously, we have gotten to 50,000, and we will keep climbing. God has helped us tremendously. By now, by the modeling, probably our figures would have been much more than that. But we have accepted here severally that for every one test, we would have lost between 6, 7, 8. So if there has been any major challenge, it's attitudinal. And that's why we have tried as much as possible on a daily basis, trying to get Nigerians to understand that this is about self-preservation first, preserving your loved ones, preserving your family, and preserving the community, and preserving the nation. If we can just get Nigerians to have a paradigm shift, a slight bit of an attitudinal change, I'm telling you, with what I've seen and the way that we have been able to moderate even our fatalities to a large extent, the rate of community transmission that is ongoing now would have been dampened. So going forward, what I'm saying is that I had reported today that our hotspots started from 10. They got to 16, they are now 20. And some of the locations where we are having the hotspots are not as easily accessible to medical care as we would have expected. One, because of total neglect of our medical infrastructure in the first place. But I believe if we can just shift a little bit, that challenge that you asked for, the peculiar one, which is attitudinal, which is our response as a people, our level of compliance, if we can just up our game a little bit, I can assure you that COVID-19, as much as it is ravaging the entire world, we will be able to have a hold on it until any form of cure or treatment comes onto the surface. I stayed up yesterday watching the Democratic Party convention in the US. In my 60-plus years, I have never had one single item dominate an election like COVID-19 has done. One issue. The biggest and the greatest democracy that we have copied is saddled with one issue that will determine the outcome of their election. Nobody is even talking about the economy. If they talk about the economy, they tie it and come back to the impact of COVID-19. If they talk about the absence of inclusion as far as their social security net is, they come back to COVID-19. If they talk about the failure of their governance system, which has been exposed as a result of the impact, it has to deal with COVID-19. That we are still standing as a country and doing the best we are doing so far, I think is the help of God. And not because of the infrastructure that we have, not because of the maturity of our governance system, not because we have even an inclusive social security net. When we started, we had palliatives to share. We didn't even know who were eligible to collecting the palliatives, because our social data is either non-existent or cannot be credible. So we have come a long way. My appeal this evening is for Nigerians to understand that we can only win this battle if all of us will collectively resolve that everyone and each one has a part and has a role to play. Thank you and good evening.
Thank you very much. Being asymptomatic does not guarantee immunity forever. We want to take that message home, and we want to encourage our youths to be quite responsible. To one and all, we want to continue to keep to the COVID-19 protocol. We want to wear our mask all the time. We want to keep to social and physical distancing, avoiding large crowd, and only embark on essential travel. We want to also go for our own tests. And as we heard from the chairman today, FEC has approved the national policy on ethics and integrity. But we continue to work together. We want to stay safe and look forward to meeting you once again on Thursday. Good night.